Welcome back to CBS News Detroit at 4. It seems that every year video games become increasingly popular among kids and even adults, but there are concerns about how they affect mental health. This weekend, the Michigan Science Center and Detroit Wayne Integrated Health Network are teaming up to explore the association between the two. DWIHN Chief Medical Officer Dr. Shama Faheem joins us now in studio to explain. Thanks so much for being on with us this afternoon.
Happy to be here.
Love to hear that. So first and foremost, what can people expect from this event in terms of activities or maybe who's attending?
We are definitely looking forward to this event. It would be a unique opportunity because we are trying to balance this activity where they're enjoying, they're participating in the games while learning the moderation, while learning what is good, what is bad, how much of it is good and how much of that is bad. So I think this is a unique opportunity and we're really looking forward to it.
I think you just said a word that's going to be a relief to parents out there and gamers out there. Moderation. So this is not a put the controllers down, don't do it. It's just some healthy techniques.
That is true, because as we're talking about the effect on mental health, there is not such a strong connection. Like, the research is there, but it's not as strong. It has found associations. There are both positive and negatives to it. So there are some studies that have talked about how video games could help with certain mental health issues. For example, loneliness. We have heard and we have seen during pandemic, how loneliness contributed to higher rates of anxiety and depression. So I think that where some people who struggle with interactions otherwise, whether it's autism spectrum, whether it's social anxiety disorder, I think they're able to connect with people and have that interactions with the virtual community. So in that way, it could be helpful. But again, if it's not in moderation, then you can see effects on mental health, whether it be anxiety, whether it be sleep deprivation, whether it could be depression, sometimes even, I would say, irritability when you're not playing or when you're asked to leave the video games, the irritability and anger that could be associated with it.
You just talked about so many things, loneliness, irritability, your mental health. Are there more positives? Like, I think I was preparing for this before the show and I saw you say something about young people and problem solving. What's the component there?
So yes, there are some studies that have found some benefits on the cognitive side. So for example, help with attention span, problem solving skills, information processing. I think what is tricky though is people are not sure if the benefits they see during the game, if they persist outside,
okay.
if you apply the same benefits. So I think more work is being done to study that. But yes, there are also some benefits where they're using video games for people with ADHD to problem solve things, to improve their attention span. So I think more research is going on in that area.
Before we run out of time, I do want to ask you, for parents out there who may have a gamer, their kid, their spouse, whatever it may be, let's go the kid route. How do you know if your child is taking it a little bit too far? What are the signs that a difficult conversation may need to take place?
Yeah, that's a very good question. I think for parents to know in general, again, as I said, moderation is the key. So when you should start thinking that it is becoming excessive if the child is not able to sleep, if the child is not able to, if they're feeling anxious when they're not playing. Those are some of the things that you would start to pay attention to if they don't want to socialize otherwise because they're playing and they're just finding their socialization on through the gaming. So I think those are some of the things to watch for. In general, there are mixed guidelines, but anywhere, like, I would say 10 hours per week is the average time.
10 hours per week.
Yeah, that is recommended.
Where can people find you?
People can find me through
For more information.
Yeah, for more information, you can always reach out to Ask the Doc at DWIHN. I can answer any questions if there is. Detroit Wayne is always available. Our website is available for more information and services.
Dr. Shama Faheem, thank you so much. I just can feel your brilliance on this subject, and if I needed somebody to tell me to cut back on something, I would want it to be you. So thanks so much.
Thank you so much for having me.
Thanks for being with us this afternoon.